right. Hear ye, hear ye. The Health and Human Services, the Lane County Commission will come to order. I'm in as chair today. Our chair could not make it. So, Madam Clerk, what do you have for us?
Commissioner Baker McCormick, Commissioner Marecki, Commissioner Anderson,
Present.
Vice Chair Colleen.
Here.
Chair Scott has requested an excuse. You have a quorum present.
Thank you very much. B,
Chair's remarks.
none for today. Next.
C, approval of the October 8th, 2024 meeting minutes.
Any additions, changes, corrections to the minutes? Hearing none, we don't have our pads, so we do voice votes. All in favor, please say aye.
Aye.
Aye. Opposed? All right, we have minutes approved. What's next, Madam Clerk?
D, unfinished business. There is none listed.
Okay.
Item 1, under new business, requesting commission approval of Amendment 9 to a 5-year professional services contract with a 1-year option to renew with Assured Family Services for the continued provision of juvenile and youth assessment, mental health, and substance abuse testing services.
Okay, if the department can join us, and this looks like a new company we have coming in. So what are we looking at here with Choices?
Hi, good afternoon. Tia Lorraine, Deputy Director of Juvenile and Youth Services. And this is just a commission approval of an amendment number 9 with Assured Family Services. And this is going to be for the DWIN funding of $2 million to continue their mental health and substance abuse testing.
Okay, have we been using Choices, or has?
Yes, correct. Yep. So Choices is a little bit more information on Choices. It's the community health outreach, intervention, and clinical engagement. And it is a specialized outpatient mental health program that is provided by Assured Family Services to do the testing.
I have a few questions. Outpatient.
Yes.
Assured Family Services, I thought they were reviewing people coming into our system.
Yes.
So
at
that we
JDF.
have, so, well, two things. First, the funding from the Mental Health Authority, DWIN,
Yes.
because I believe it's $5 million a year that DWIN puts into the county budget.
I will have to double check how much it is annually, but at this time, I think we're only asking for the $2 million.
Right,
Yes.
right. But that's really general fund money. It's money that DWIN has given us, and
Yes.
now we're using part of that for this.
Yes. So we receive the funds from DWIN, and then AFS gets does the services, and then we pay them through that same fund.
Yeah. So DWIN, and it's mentioned here too, serves the severely emotionally disturbed, SED.
Yes.
How many youth do we have? I don't know the appropriate way to say it, in our system that are SED.
I will have to get you the total number. Would you like the total number of SED designated children at JD?
The Juvenile Detention Center?
Yes.
I can see, okay. So who provides the services to those young people then? Choices identifies them?
So Choices, I will have to get back with you when it comes to what Choices does, but the AFS is the provider who does this a specialized treatment program, and they are within the community and also within JDF.
Seems like it'd be difficult to have SUD individuals in the JDF and interacting with all of the other young people in there. So how long has Choices been with us?
I will have to get back with how long Choices has been with Assured Family Services and how long they have been providing services to our youth.
Because I would like to hear what we found when we did this testing. What is the resulting services that these young folks get. Okay, yeah, a little more complete on choices, how long it's been around. Right, how many
Absolutely.
kids both in and out of the JDF do we have there?
Absolutely.
We wouldn't have anybody on tethers, would we?
At JDF,
Yeah, from JDF.
on a tether?
Yeah.
So no youth are on a tether at JDF?
Yeah.
Once they leave, then yes,
When they leave.
yes. they
Yeah, and
could.
I would like to know if SED kids are on tether too,
Okay,
because then the family in the home has to have something for the severely emotionally disturbed, which is a technical, I don't know if everybody knows, it's a technical, these are people that have the most difficult of mental health diagnoses if you're severely emotionally disturbed.
I'll
These
get
are
you
the
the number. of
these are the
kids.
folks with the toughest diagnoses.
Yes, I can definitely get you that designation, how many youth are designated with SED as well.
Yeah.
All right,
And
let's
to that
open it up to colleagues. Yeah,
I
Commissioner
was
Baker
just,
McCormick.
As to the SEDs. So you just indicated that and I guess I never thought about it and realized that we have them in the JDF.
They could be, so some I'll have to exactly know how many are, but they might have been diagnosed with those disorders, and then they do have that designation within the community that they might be at JDF, but I can't confirm, but I can definitely get you the number if we do have that designation.
And so I guess in my mind, I just didn't think that they would be there because it would take specialty services and they're probably behaving in a manner because of their issues, their illness. Yeah, so yes, if we can get those numbers, that would be
Absolutely.
interesting to know. Yeah.
I will.
Anything else, Commissioner Baker McCormick?
Nope, that's it.
Commissioner Marecki.
Thank you, Mr. Chair. Okay, so the term of the contract will remain through March 31st of 2025, and there are no more options to renew. So what are the plans after this renewal?
We have not discussed the renewal plans at this time, and then when we do, we'll definitely communicate that.
Okay,
But we'll definitely continue to look into how we can provide these services and these assessments.
okay. Because this has been a long contract since 2018.
Yes.
Okay, all right, thank you.
Commissioner Anderson?
Just one quick question. Have we seen the numbers increase since we've been using this vendor or this contract?
I will look into those numbers and then get that for you.
Just like to
Absolutely.
see, what type of response, they're getting. I mean, what they're actually doing for us, if it's making a difference, that's all.
Absolutely. I will
Thank you.
get all that data to you guys.
Again, it's been a long, just a long. contract.
Yeah. Well, that was Assured Family Services, and it was the JAC before that,
Yes, sir.
Juvenile Assessment Center,
Mhm.
which has done a very good job for us. I don't know if my colleagues would be interested, but I'm thinking that we make an agenda item maybe 2 meetings from now, because we've talked a lot about choices and other data that we need, just to have an agenda item to discuss choices and, because I'm really concerned about the interaction with the other kids there. That possibly confrontations would occur. People getting teased, so is that, committee members, would you like to do that?
Yeah.
Put it on.
As long as it's after the election.
Yeah.
I'm sorry.
As long as it's after the election.
Yeah, we'll do a couple, well, I don't want to rush the department into it,
Right.
but if we say not at the next meeting, but maybe the meeting after that, a month to kind of gather and let's have more of a conversation about these youth. Okay. Any other questions from committee members on this item?
Thank you.
Ready for a motion?
I'll move approval.
It's been moved by Commissioner Marecki, supported by Commissioner Anderson. Any other questions before we vote? Hearing none, all in favor, please say aye.
Aye.
Aye. Opposed? Any abstentions? All righty, Madam Clerk, what's up next?
Item 2, requesting commission approval of a one-year comparable source contract with the National Partnership of Juvenile Services to provide training and technical assistance services to the youth in custody at the juvenile detention facility.
Okay. Well, welcome. Name and titles for the record, please, and tell us what we have here.
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services.
Mac McGee, Division Director, Division of Institutional Care.
So what we have is our request for approval of our contract with the National Partnership for Juvenile Services. I'll let Mac talk about NPJS, what they do and what we'll be doing with them at the detention center.
So NPJS, or National Partnership for Juvenile Services, is a national professional development, technical assistance and training organization that's been providing support of best practices to the field for over 25 years. More importantly, wherever there's been a jurisdiction throughout the country that's been in trouble, so to speak, or under a federal consent decree or a settlement agreement, usually NPJS comes in and assists those organizations in getting their standards up to par. So this is an organization that we're looking to work with to help us develop our behavior management system, which was very important in operating and running a juvenile detention facility, as well as assist us with our mid-level management training by providing training throughout this next fiscal year that will help to build and support the needs of our middle managers. In addition to that, they will provide some assistance with developing. So we're building a training academy, which is very important. We can get the bodies in the building, but those staff have to be trained, right? And so as we build our training academy, we brought on a training director, we're bringing on 3 full-time training specialists, and we want them to be able to understand adult learning theory, be able to craft trainings and workshops so that our staff are able to transfer that learning from the training onto the units with the young people, which will help to reduce incidents, which will help reduce situations that occur that impact the daily operations of the facility. And so NPJS will be coming in and providing coaching and development of our training team, which will hopefully in a year from now, we'll be in a much better position than we are now.
And if I can add, NPJS also will have embedded consultants that will be working in the facility on the floor a couple of days a week and meeting with us weekly to discuss what we need to do to continue to build our department.
Your name again, sir?
Mac McGee.
Mr. McGee.
Yes.
You mentioned other facilities that under federal consent. Do the feds require bringing in a company like?
I don't want to say the feds required it, but it's been a best practice. And so I know just from my experience, they were brought in over a decade ago when Cook County went under federal jurisdiction. They spent time in Washington, D.C. They're currently in New York City providing technical assistance and training once those youth had to be moved from Rikers Island into juvenile facilities in the Bronx and in Brooklyn. And they also do work in South Carolina and other jurisdictions around the country. So very reputable, and they're unique. Their niche is in the embedded consultants. And so they take high-level individuals, usually individuals who have ran facilities at a very high level, and bring them in to help as embedded consultants. And they're able to not only institute or implement behavior management systems because of their eye and their experience, they're also able to help us streamline and put other systems in place that will make us more effective and efficient in the work that we do.
So they're gonna come in to set up a behavioral management system,
Yes,
and it's a 1-year contract.
yes.
Is the anticipation is that they will train our people and we'll be able to take it from there after 1 year?
That's the plan, yes.
Right. And if I can add to, with the training academy, we'll be building our own training academy. It's our hope that we'll become the experts in training, not only for GDF, but for other jurisdictions around the state as well.
Good.
And if I can add our goal, it's been 2 years since I've been here, but in the next couple of years, we will be an accredited institution.
Mhm.
Okay, enough for me. Commissioner Marecki?
Thank you. So our staff has noted that this is a comparable source contract. So this company, nobody else does this type thing?
So no one else does so it's a lot of organizations, like we reference, the Center for Juvenile Justice Reform. They have high-level consultants, but no one does the embedded consultants, right? So what those other organizations do, they'll come in, they'll do an assessment and tell us, oh, you need to do this. The benefit and the feature that NPJS provides is that those consultants are on the ground, right? And they can actually see, provide feedback to the leadership team, help us put systems in place. And the direction that we're trying to go, of course, we want Wayne County to be the leader in this field in the next couple of years. That's definitely the aspirational goal. And we believe NPJS partnering in will help us to get there.
So this will be a step towards the accreditation that you desire. And I guess my last question, did anybody tell us we had to do this? Okay.
No, not
Okay.
at all.
I was trying to read faces there. But okay, all right, thank you.
Anything else, Commissioner Marecki?
No, I'm good. Thank you.
Commissioner Baker McCormick?
Thank you, Mr. Chair. I am excited about this contract because I think it's going to move us in the direction that we need to go with a company that is able to train our folks, and then we take that knowledge and we're able to continuously train so that we're not losing our good people, our good
Right.
workers. So yeah, I'm happy about this. Thank you.
Thank you.
So behavioral management system, does this mean we're gonna have another little department over there?
No.
It'll be called BMS and
No.
No.
things I gotta do in my chair. All righty, any other questions from committee members? I'll take a motion then.
So moved.
Commissioner Baker McCormick moves to approve, supported by Commissioner Anderson. One last chance, folks. Questions? All in favor of the motion on the floor, please say aye.
Aye.
Aye. Opposed? Abstentions? All righty. Madam Clerk, can we go to the addenda for item 3?
Moving to the addenda, item 3, requesting commission approval of amendment 1 to a comparable source contract with 2 one-year options to renew with Just Air Solutions, Inc. for professional services subscription to monitor the region's air quality with digital inhaler medical services and provide county leaders and residents with the information to improve air quality, health outcomes, and quality of life for residents.
Good afternoon. Name and title for the record, please.
Yeah, Dr. Abdul Al-Sayed, Director, Health Officer, Wayne County's Department of Health, Human and Veteran Services.
Aja Harris Martin, Chief Program Officer for Wayne County Health, Human and Veteran Services.
And apparently down there, when both mics are on at the same time, you're going to get feedback. So I'm just, so if you'd like to introduce, Dr. El-Sayed, what we're looking at here.
Yeah, so you all are familiar with our project with Just Air. We've been able to build out this 100 unit air quality monitoring system. It's delivering real-time data out into communities. There's a second portion of the project, which includes 500 individual monitors. Now, in order to deploy those, we need to have folks consented, and we would like with Just Air to develop that consent agreement and to hold that consent rather than the county to do it. So in order to do that, we need to equip them with the funds to develop and then deploy. And then there's going to be outreach programming around deploying these that they will take on. And so this is a very small amendment to the contract to facilitate that second part of this project.
Commissioner Marecki.
Thank you. So the contracts will be with the contracts that they put in place they will be talking to families, or how is this going to work?
So when we deploy these individualized air monitors, there are going to be individuals that hold them. They're going to be collecting data. And in order for us to collect that data, we need to make sure that, you know, we are certified to collect that and that they've signed the appropriate consent agreement to allow us to collect their data. And this was, you know, when we had moved this contract, we had assumed that we were going to be able to develop this in-house, but considering the data flows, we actually don't really want that to be developed by us. We would rather Just Care develop that. Although we will hold that data, they will not actually hold that data. It's important that because they collect it and move it to us, that they're developing the legal language around doing so.
Okay, and would they be developing like criteria?
So we are co-developing criteria.
Oh,
And
okay.
yeah, the main deployment will be among young adults. Now, we had
Oh,
initially
okay.
wanted to do children. That gets a lot more complicated. And also kids destroy stuff. I can tell you as a father of a 6-year-old and a near 2-year-old. And so the project gets a lot more expensive when you've got backups upon backups for kids. So considering the asthma profile in our communities, we figured that probably the best, in terms of our goals, the best target would be young adults.
Okay, and you know what? I think that's very wise because little kids have no control of their environment too.
True.
Maybe it could be taking an inhaler while someone's smoking a cigarette next to them. So I mean, at least older kids can kind of, so they would develop a criteria, they would talk to the families, or you would develop the
We
criteria
would
with
co-develop the
them.
criteria with them, yeah.
And then just the data is given to Wayne County.
Right. We end up storing the data.
Okay.
Right.
All right, thank you.
Commissioner Anderson?
Thank you. Dr. Syed, I just wondered, have we received an update recently about what we've learned from since the contract was initiated with Just Air?
Yeah, so we actually got our first 3-month report, and we've been analyzing that, working out some kinks in the data. We've got an upcoming committee of the whole, and as part of that, we're hoping to give you a sense of what we found and then also share a bit more about other projects coming, et cetera. So,
And how many units do we have in the field right now?
so there are 100 fixed point air quality monitors, and this is for the deployment of mobile air quality monitors.
And the fixed units, where are they located now? I mean, I know 100 of them.
There's 100 of them. So I would invite
Run
you to
them
go.
down, come on.
All right, okay.
I know
there's
you got it at the top of your head.
I've actually got a map of Wayne County on my chest. Let me tell you. I would invite you to go to waynecounty.com/air quality, and you can actually get a real-time map that updates every 5 minutes, and you'll have all the points right there.
And data,
And data, yeah.
and data.
Okay, thanks.
All right.
Thank you.
Commissioner Marecki, you want back in, then I
Yeah,
got you,
just,
Commissioner.
so, and the state has their monitors around too, right?
Yeah, and then the main ones are actually EPA monitors, but yes, those are still there.
Oh, those are EPA. Okay, so are you looking at any connections with their data and our data?
Yes, so that data is publicly available and we can certainly scrape, and we use that data to validate ours. And the nice thing about what we're doing is you've got very high quality, but very few federal and state collection points.
Yeah.
So you can't get the same kind of tight reading that we're trying to deploy. So if you're thinking about neighborhood by neighborhood reading, that you're not really going to get that from what the state and the feds look at. And so yes, we still have that data and we use it to validate our monitors, but we get a lot tighter in terms of the level of analysis.
Okay, but you're still looking to make sure something's not way off from.
For sure, yeah.
Okay, Right, thank you. Thanks.
Commissioner Baker McCormick.
Thank you, Mr. Chair. So there's gonna be 500 young people that have the inhalers. Have you determined how or who these individuals will be?
Yeah, so we're working with both the public health, we have the children healthcare special services in Wayne County and as well as Detroit. So that will be our primary contact because they have asthma as one of their key indicators for that group. And those children are 16 to 26. So they stay within their pipeline until they're 26. So that's kind of our main goal, is to get as many of those monitors as we can through that phase of outreach. And then we'll continue outreach in kind of hotspots that we notice. There's several high schools that have air quality monitors that we notice, they continually have kind of bad air. Melvindale being one of them. So we're going to try to do some special partnerships with those schools to get additional kind of mobile monitors deployed there.
Okay, and so I was trying to remember what, once we have this data, what are we going to do with it? Like, I know the ultimate goal is to try to detect where, the air quality is poor, but then what?
So there's two pieces. The first is we are able to move real-time information to families. And so when you've got alerts for bad air, you can get a text message and that'll tell you the air quality in your local community is poor. But the second part of it, where I think actually there's a lot more power, is the ability to assess and ascertain what the output from high emitting polluters in our community is and how that then shapes health, right? The nice thing about these units is we're not just deploying mobile monitors, we're also deploying these units that will go on a inhaler, so that every time somebody hits their inhaler, we're getting information about them hitting that inhaler. So rather than just getting broad information about poor quality air, we're going to be able to correlate that to a health outcome in the setting of an asthma exacerbation, which is when you use your inhaler. And with that, with time, we are able then to collect spatial data. Where is it that this constellation of bad air quality and people using their inhalers is the worst? And then correlate that with places, right? And who those big emitters are. And we're able then to use that data to start holding them accountable. Now, we don't oversee air quality, right? There was a time when the county did oversee air quality. We don't. But our data can be really useful when the state, for example, makes decisions about changing the licensure for a large emitter. And so being able to have that extra set of eyes is really critical. I'll also tell you that we know that we're not the only ones watching. So a lot of these companies have access to our data too. And so if they're seeing spikes, the best bet is they probably don't want a confrontation with us. So they're going to ideally unilaterally start making improvements in their own facility because there's another set of eyes. And so there's a lot of outcomes here about having this that I think are really important. And then lastly, this is publicly available data that we want to put in the hands of local communities to be able to advocate for themselves. And I think having that in a local neighborhood is really critical when you're starting to talk about, well, for years we've been breathing downstream of a large smokestack, but now we know the real-time air quality in association with what we've been smelling, and then B, what the implications of that look like for kids in our community with asthma. And I think that's where the power sits.
And so with the data that you collect and working with various entities, and I guess the state you mentioned, will you coordinate any efforts? I don't know if what I'm looking at is something proactive in the sense where you can reach out to the state and say, hey, these are our numbers and they're increasing. Are we gonna sit down and talk about how and what to do about the numbers?
Yeah,
That's what I mean, actionable items.
We're in regular communication, obviously, with the state health department and Eagle, and where we have an opportunity to raise the alarm, we certainly will do that.
Okay.
And so in that respect, it's a value directly. But I think the big issue that has really, I think, dogged our community for a long time is when the state makes decisions about emissions among high emitting polluters in our communities, oftentimes they use this broad swath EPA data, which is not scaled well for what local communities experience. So when we bring our data, or even more importantly, when we give local communities our data and we stand beside them, advocating that maybe increasing the licensure for more emissions at this particular polluter, you name them, is not a good idea, we're going to have some real numbers to back that up.
Right. And that's what I hope to, see coming from this initiative, is that we can actually use the data and say, hey, we need XYZ to happen because we have the data to prove it. So
Did you want to add something?
thank you.
Commissioner Marecki?
Yeah. Recognizing me again, but I thought of a couple more questions. if
Recognize
Monique-
you every day. I go, yeah, here's Commissioner Marecki.
Okay, two things. So are there like little GPSs on this thing? You're saying, oh, there are, okay.
So you want to describe it?
So the mobile monitor is actually a kit. So one, it comes with a kind of device that you put on top of an inhaler. It's
Okay.
not a medical device. It doesn't interfere with taking your inhaler, but it tracks when you take your inhaler, essentially, so that we can track exacerbations. And then the mobile monitor, it is GPS enabled. It has a Bluetooth sensor in it, so it does have to be connected to a cellular device. But the positive thing is if you have your inhaler, but you don't have the mobile monitor, given our expansive network of 100 air monitors, when you press the button, it will take the local air quality and log that in the system. So as soon as your kind of inhaler Bluetooth device is connected to your phone, it'll log all of that data in there.
Okay. And then was one of my concerns when we first started this. Now, the lists of these kids that you're going to get through the organizations that
Social
you
Healthcare
mentioned,
Services.
you mentioned, there's so many factors that can go into asthma. I mean, not just a lot of stuff. So do you know if these kids are kind of well-controlled asthmatics, or they're not used to taking their inhalers? I mean, which could exacerbate something.
Yeah.
I mean, being an asthmatic almost my whole life is like, there's a lot of stuff that goes into this, but being well controlled to begin with
Right.
helps.
So admittedly, we're not collecting a full healthcare history battery. I mean, if you wanted really, really tight individual level ascertainment, you'd get that. But what we're really trying to do is say, across our population, here's what happens when you link indoor air quality, outdoor air quality with the outcome of an exacerbation, right? The other part of this is that if they have an inhaler, they're under some sort of control, right? Some sort of medical supervision. Now, of course, it may be that they may not be taking their baseline medication. It may be that they don't have it on them. There's a whole bunch of features there. But across 500 individuals, the idea is that a lot of that sort of washes out, and you're able to get broad swath associations between outdoor, indoor, and use. The other part of this is, leading the analysis is going to be our chief epidemiologist and health information officer. And we're going to be working with partners at other universities to try and really, really squeeze all that we can out of that data. And certainly they'll be thinking about some of these questions of variability and control and healthcare access, et cetera.
So these are actually rescue inhalers. These
Yeah.
aren't steroid inhalers. And so you're going to know if the kids are on steroid inhalers or on medication.
We are going to try and collect some of that information, but
Yeah,
not all of that
which
information.
really helps with control.
Right.
Okay. All right. Thank you.
I'm going to take a soapbox minute here. I remember when Wayne County was contracted by the state of Michigan to do air quality monitoring here, and I would be hugely supportive of renewing that relationship and having us doing the air quality monitoring here. A concern I would have is we as a county might have a different view than the state of Michigan does, particularly on some economic development. I'll just say it that way, programs that go on. And I think for us to have the local voice here saying this is what we see, I think would be advantageous to our citizens. Now, just same kind of data that we're looking at today.
So our network includes the city of Detroit.
I know your network does.
Yeah.
But Just Air has a separate contract with the city, correct?
They do. And the nice thing about one of the reasons that we went with them is that we can collect their data into our data.
Yeah.
So we own and operate 100 of these monitors, but we're collecting data from more than 100 because of the existing Detroit and Dearborn monitors.
Yeah, and I was wondering whether Just Air is collecting the kind of data that you're asking for here already in those two other jurisdictions.
Yeah.
So they're kind of ready to go to do this. All 100 are up. You can look on the county website to get the real-time data for what we have out there. What's the plan for distributing, a timeline, I should say, for distributing the 500 to individuals?
Our goal is soon, but we also realize that the weather may be upon us because we live in Michigan, and we also realize that those who are our target audience often, have other social health needs challenges. So we're thinking through that constantly. So depending upon when this is passed, we have to kind of update our timeline a bit. But it is our goal to have a mass distribution event. So that will be like a large distribution where the people that we've identified with the City of Detroit Children Healthcare Special Services, as well as our own in Wayne County, we do marketing, we bring them there, we distribute as many monitors as we can, and then in the geographic areas of high air quality or bad air quality, we'll do micro events or micro kind of distribution events there within that local population. So it's a high partnership with local community members as well.
And admittedly, right, the most important rate limiting step has been getting through commission. So, we've said that as soon as this passes, we're ready to go. So,
Okay.
Yeah.
So we think all 500 will be distributed by, I understand the steps you're gonna go through, but we think all 500 will be distributed out there by,
I'll say end of January.
okay.
we would like all 500.
Yes,
Yeah.
we would like.
Yeah.
Yeah, winter's tough on mathematics. Yeah. Okay, Commissioner Baker McCormick.
To that point, are there any incentives for them to participate?
You get access to your own data real time,
Okay.
which is valuable, right? You know what your indoor air quality is everywhere, but no, there aren't, other than
Okay.
that.
Okay, I was just wondering if that was a thought. I mean, if there's some type of, something to,
Yeah, I
reason
mean,
for them to,
the event is cool.
Yeah.
We will make it a fun event, just like our vision program, right? Where you're receiving this thing, right?
Okay.
And we're gonna make it super exciting for the young adults that we kind of identify. So as Dr. El Sayed said, the real benefit is that you get this cool device, right? And like it connects, and let's show you how it works.
and,
And then you can talk to your provider about this as well. Like you have this app. So now when you go to your primary care physician, you can show them this data and talk to them about that.
so is it for one inhaler, one device, or is it more? Like if you need another prescription, you just pop it on to the next
Yeah, so
prescription?
the inhaler tracker is a kind of case. So you
Okay,
can
but how
go
long is
over
the
it.
tracking?
It
Like,
was, we haven't had a determinate amount of time. We're trying to aim to a year, but the device doesn't kind of,
okay, for
die.
1
Yeah,
year?
yeah.
Okay.
so it doesn't die. But we know that we're gonna have a lot of data and we're gonna need a lot of data storage for that, right? And so we're trying to see how much data comes in, and then I think we can better assess how long we continue to track this. But right now, what we're kind of including in the terms and conditions is a year.
Okay.
No problem. I'll just,
Mm.
Commissioner Baker McCormick.
Oh, I think so. The length of time is, you said, a year, and I think that was the last question I had. Yep, so.
We'll go to
okay.
Commissioner Marecki.
Again, thank you. And I would think this would be helpful because if someone's using their rescue inhaler 2 or 3 times a day, there's something's going on here. I mean, their doctor needs to see that it's more than air, it's other interventions. I mean, that might be hurting it, but they need other interventions to have a normal life.
The Just Air founder, he lives with asthma, and he's been beta testing the prototype. And for him, he said, he never really put 2 and 2 together on a lot of the exposures that were really causing him exacerbations. And in having this on him for several months, he was able to identify certain neighborhoods, certain rooms where there were issues. And over time, he was able to correlate that and really think a bit about, okay, what am I doing that I can, what are the adjustable habits that I have that can help me here? And so he found it to be really insightful and helpful.
Yeah, good.
Right, thank you.
Commissioner Anderson.
Thank you. Doctor, I was taking your advice and taking a look at the site here on my phone, and everything is either yellow or green that I see on there. Nothing that's of any concern according to this. So when have we seen something that would be more of a severe
So
Okay.
ironically, the day of the fireworks,
Mhm.
yeah, that whole week, but in particular, the night after the fireworks, Detroit had the worst air quality in the world. And, all of our markers were red. And then, we had a couple of instances of wildfire activity that we were able to pick up. And then there are some communities that just generally are more likely to be yellow on green days, right? More likely to be red on yellow days. And that activity we're picking up too, and they're in the communities that you would expect, considering the footprint of some of the higher emitting polluters. So
So the wildfire fire readings, was that due to what was happening in Canada?
Yeah. Yeah.
Okay. All right, thank you.
And you want to join us here, Commissioner Clemente? Do you have questions on this item?
Question and comment, maybe, if you don't mind, Mr.
We'll
Chair.
take both.
Thank you, Mr. Chair. So just a comment, representing the cities and that have the worst air quality. I was just down at Ballinger Park in River Rouge, and completely surrounded by that park is industrial areas. You will, I think the meter sometimes reads the whole county and not individual places. Am I wrong about that, or it's a whole?
our meter is individual. It's
Individual.
very local.
Okay, yeah. So a lot of times when I look at it, I will see red in my areas, and because it's so industrial. And I think this is super important. I did have a question about I walked in on this and I'm very happy about that. One of my friends who lives in Wayne County is having a terrible time, so much that she is having to stay in her home a lot of the times because of her asthma and things that have happened with her lungs. I can't remember, is it just children that we're going to be tracking, or are we going to be tracking adults? Because I think she would be a really good candidate. Possibly.
Mainly young adults.
Young adults.
That's who we're
Okay,
mainly focused on.
I couldn't remember. Okay, that was my question.
Thank you, Commissioner. Thanks for stopping in. Is there, and right now I'll just do yes, no, I don't want to open up a whole new can here. But in talking to the families, do we interview the families? Because they will know that every time my kid goes here, they have a problem, or can you, through the family will know where the kid runs into problems. And, if it's again and again that do we have the ability to do those kind of interviews and collect that kind of data?
I say it's beyond the scope of this project.
Okay.
My hope
Yeah.
is that people who carry these will have that conversation with their family, and they can leverage that data to
There you
make
go.
great choices for themselves. That's the hope.
Okay.
But at this point, it's a bit beyond the scope of the project.
Okay. Commissioner Baker McCormick, please.
How long does is it ran by a battery, or how does the monitor work? And is it chargeable, or how long will they work?
The mobile monitor does run off of batteries. The tracker that I mentioned that goes on top of the inhaler, that's actually a great question. I'll follow up with Just Air today to understand the battery life for those things, and I can find that out.
And so if they lose it, or the batteries run down, or I don't know if I would assume that it's probably rechargeable, I would think, I don't know. Do you have a way for them to get a new one, or?
So they'll, in their kind of like mobile monitor kit, that's what we're calling it. There'll be information to Just Air for any assistance, whether it's technical assistance in connecting the app, et cetera, or equipment malfunction. So that'll be on Just Air, and that's a part of the kind of contract that we have.
But if
outside
they
of this
lose it, do they get another one,
Creating-
or we
Yeah,
go
we're
to the
creating
next person?
contingency plans
Okay.
with Just Air, but that is on top of our minds, which is why
Yeah,
we increased the age limit.
age
'cause we
limit,
were
yeah.
never-
And
we were
it's
never
to a
gonna
certain
do
point,
Yeah.
right? We're not buying twice the number so that everybody has a replacement, and we can replace to a certain point, and after that, then we can't.
That's it, okay. And then this project is what's the goal as far as the term of it?
So I believe
Um,
we're In the second
no,
year
you
of the
said-
3-year.
2 years?
I think it's a 3-year.
3-year, optional, 2 1-year renewal.
Okay. All right. Thank you.
Commissioner Clemente, were you signaling there? All right, I'm not going to recognize you then.
He has no problem recognizing Commissioner Marecki, so.
Yeah, no problem. But she's more next door rather than down the hall. I want to thank you for bringing this to us. I think you can tell the support among the commission for the good air quality and where we happen to be. The remains of the industrial giant that's still out there that is the city of Detroit and surrounding areas. So I want to thank you, and then I'm looking forward to what the data is really going to be to tell us. Any other questions from committee members? How about a motion?
I
Oh,
I will make,
Commissioner
I will make a
Clemente.
comment. I
Okay.
just want everyone to know,
Well,
and
we'll
I'll
take comments.
I'll say this again, at full board. Darren and his team are amazing. And if you want to take a field trip, reach out to them because, they are really open to having people come, see what's going on, look at things. I did that. And it is something that if you want to educate yourself more on, they're very open to talking to you. We know his story, but he didn't discover that he had asthma until he was older. And then he actually worked, to develop this company, and it's going international and nationwide.
Mhm.
He's very open to talking to everybody. And I think collecting this data is super important so that we can hold people accountable. So thank you. That's all.
Thank you, Commissioner. Is there a motion on this item? Moved by Commissioner Anderson, supported by Commissioner Marecki. All in favor, please say aye. Aye. Opposed? Abstentions? All right, motion passes. Madam Clerk, what's up?
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
Not aware of any. Next.
G, public comments.
Anybody on Zoom have a comment? We'll start there. Anybody on Zoom with a comment?
There are no hands raised on Zoom.
Did we get any emails per chance, Madam Clerk?
No emails have been received.
No emails. Anybody in the committee room would like to have comment to the Health and Human Services Committee? Anybody in the room? Okay. We'll move the agenda then. Madam Clerk, what's next?
Adjournment.
Right. Not hearing any objections. We're adjourned.